I'm delighted now to be joined by Professor David Williams from Bart's in the London School of Medicine and Dentistry and Professor Michael Glick from the University at Buffalo, and also both co-chairs of the Vision 2020 think tank. Gentlemen, thank you both for joining me.
Thank you for having us.
Thank you.
Michael, I wonder if we could start with you. Maybe you could just tell us, for anyone that doesn't know, what is the Vision 2020 think tank?
Vision 2020 is the strategic plan for FDI, the World Dental Federation. And it was very clear after creating the strategic plan that there are challenges and opportunities for dentistry. And it was also very clear that we needed to address some of the more pressing issues that face our profession. And with that in mind, a think tank was created, and David and I got the opportunity to actually head up this think tank. We then looked at the issues that could move our profession forward and realized that probably the first thing we need to do is to define who we are and what we need to do.
So, David, when we talk about what oral health is, what does that term mean?
Very good question. And that's really the fundamental question number one for the think tank. So our starting point is that different groups of people, different individuals, all have an implicit understanding of what they mean by oral health, but in explicit terms those definitions are likely to differ. So, for example, within Vision 2020 we say that oral health is a basic human right. If you look at the strapline of FDI, it says in the top left-hand corner, leading the world towards optimal oral health. The question is, what is oral health? And so it was really an attempt to come up with a definition which all parties could agree encapsulated those domains. That's to say, the domain that's around the presence or absence of disease, the domain that's around function, and the domain that's around how you interact with other individuals in society.
So really unifying everyone and their consideration.
Yeah, I don't really like the term holistic. I think it's a very overworked term, but I think in this sense it's probably appropriate to describe what it is that I think we've come up with.
So then, Michael, what is the new definition?
Well, the definition is as follows. Oral health is a multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and free from pain or discomfort and free from disease of the craniofacial complex.
What do you hope people will understand and take away from that?
From a dental perspective, we're moving away from a patient coming in and defining them according to their dental needs. We're moving away from having an endodontic patient to a patient that needs a root canal. And I think that's the essence of what we're trying to achieve here, that we now treat patients, we don't only treat the disease.
David, what impact would you like this new definition to have on dentistry as a whole?
I think we feel that this new definition has the potential to make an impact really across the entire spectrum. What we want to advocate for within FDI is the integration of approaches to oral health into health more generally. And the definition that we now have enables us to have that kind of language because we're talking in the same terms.
What would be your key hope for it?
I think this definition is not a revolution, it's an evolution. What I mean by that is what David and I have done, we have facilitated a way of verbalize what every dentist really do in their office. And what we have achieved, I think, with this definition is the common language. So with this common language, that's not only now between a dentist and another dentist, it's between dentists, patients, and the overall health community and other stakeholders as well. So that's, I think, is the most important part with this new definition. We have created a common foundation and language that everyone now will understand, and when we say oral health, we all know what we mean.
So you must feel very proud of it.
I think we're very pleased with where we've got to. I mean, for example, yesterday at the General Assembly, there was overwhelming support for this definition. Now, 200 national dental associations worldwide have endorsed and supported this definition. I think that degree of unanimity of view is, as far as I know, unprecedented. I think, so in that sense, yes, we do feel very proud. The next step, and I think the thing which would give me enduring satisfaction, is the sense that not only has this definition been accepted, but it's been picked up, adopted, and is in widespread use. So I think operationalised in a word.
Well, we look forward to seeing if that indeed happens. We hope so. Thank you both, gentlemen, for joining us, and have a great Congress.
Thank you very much.
Thank you very much indeed.